Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening and welcome to another edition of Health Matters. I'm Khawa Solomon, and of course, as always, we're joined by a member of the IMA medical expert panel here on Health Matters as we discuss and unpack autism. It is officially the 2nd of April and we celebrate and commemorate World Autism Day, but it's also a month of autism awareness. April, make it a month. It's just the beginning now. So make it a month of autism awareness in your family, in your community. We do continue this discussion and also invite your input. So don't forget the number on the screen a little bit later on where you can call in live. With me, as always, Clinical Director at Teddy Bear Foundation and a resident expert, medical expert on our panel, Dr. Shaida Umar. Assalamu alaikum. How are you doing today?
Alhamdulillah. Wa alaikum salam wa rahmatullahi wa barakatuh.
Always a pleasure having you here and having you available and your expertise on health matters. As we commemorate the 2nd of April, which is today, autism is a misunderstood medical condition. Dr. Shaida, let's unpack it just a little bit to your understanding.
So I would like to just firstly recite something from the Quran. I think looking at disabilities or people with handicaps may seem or appear as objects of sarcasm and mockery, and often this is the population group that is most vulnerable and the most targeted in terms of bullying and being labeled, stereotypes cast against them. So I just to add something,
yes.
God the Almighty says, "O you who have believed, let not a people ridicule another people. Perhaps they may be better than them, nor let women ridicule other women. Perhaps they may be better than them. And do not carpet one another, and do not call each other by offensive nicknames. Wretched is the name of disobedience after one's faith. And whoever does not repent, then it is those who are the wrongdoers." And I think the important thing for us to take from this tarbiyah is that Allah has created all mankind, black, blue, white, short, tall, fat,
somewhere
thin,
in between.
and yes, people with different strengths, with challenges, with handicaps, with disabilities. We are all the creation of God Almighty. And I want to say, a learned scholar, Dr. Shaw, also said, when you have seen one person with autism, you have seen one person with autism. They are all unique as we are all unique, and we are all the divine creation of a higher divine order.
And I often see, these comments which we don't quite recognize, the support that autistic child would need and what happens behind that autistic child. We want to unpack that as well, the support, the family, the community. But let's talk a little bit about stats. In South Africa, what are the stats at the moment?
So this is very interesting because if we just look at all the desktop literature, actually across Africa, sub-Saharan Africa, there hasn't been sufficient research to confirm the incidence and prevalence of autism. If we look at globally in terms of in relation to the US, 1 in 68, and the belief is that it's probably the same in South Africa. And we know between 1 to 2% of the population could be affected by autism.
So 1 in every 26. Now, studies show that by using blood and urine samples, doctors can actually tell a mother if her child is going to be autistic. Is there a chance that your child can be diagnosed then with autism after birth?
Indeed, there are opportunities. Brain scans could certainly indicate, because the structure and formation in the brain of that of an autistic child is different. So it's very typical. But I think just for the viewers to understand what is autism, we know it's a very complex, multifaceted neurological disorder. And it affects the functioning. So we would see that there would be impaired communication, sometimes limited interactional or social skills. So it would affect communication, behaviors, thoughts and attitudes. with, the daily functioning. And I think that is something we need to realize, because often there's a misunderstanding. This is a misunderstood population group where there's lack of diagnosis or misdiagnosed, where they are labeled as retards, even in this day and age, or that, insane, lunatic, crazy, because of the kind of behaviors that they're likely to demonstrate, the repetitive movements or clumsiness, that awkward walk, lack of spatial awareness, and that tapping or flapping. So there are lots of things, and they are also very sensitive to sensory modalities, whether it's sound, whether it's vision. So I think these are factors that one needs to consider and make the public aware that these are not children that are retarded. There may be some developmental disabilities. There will be some restrictions. Sometimes it may affect them severely in terms of daily functioning, where they may need or require additional support. And in other instances, actually, limited support is required. But it is a lifelong disease. We must not forget that. There is no cure.
Is it appropriate?
But there is treatment.
There's treatment and the way forward. Is it appropriate in this day and age to medically still use the term retard with an individual that has a special need?
It's definitely not appropriate, not acceptable. It's a derogatory term. One cannot use it. We would refer to people with any kind of challenges or special needs, persons with disabilities, persons with cognitive impairments or intellectually challenged or visually impaired or hard of hearing or of hearing deficits. So I think there are more empowering phrases that one would use, because we always put the person first and then the disability.
Now, quickly, just from a personal nature, and I want to, just go ahead before we get through our questions. You work in an office that your neighbors are within the autism organization sector. You see some of these kids from close to your heart on a day-to-day. Maybe you're not at the office all the time because we know you're on the road. What is what do you see? What do you get from what you see? If not that you work with this type of individuals, one-on-one, but the condition and you see the things that you see from the school, from the organization, and the work that they do.
And I'm so glad you've asked that question, because every day it's a constant reminder. And then coming face to face with these children, that some of them are very tactile, defensive, and they would not want anybody to come close to them.
Okay.
Others would be making sounds that will not make sense to anyone. Others are actually terrified and immobilized, where the busy corridors would affect them and traumatize them. So, but at the end of the day, when you look at these children, the first thing I see that they are children. It's children first. What do we say? Bana Pele, and it is children first.
I'm so glad that you've mentioned that. And all children, whatever condition they have, you see visually or internally, they just want to be loved.
And they all are so special, because they are children that I see, and I want to also share this. The older children working in the protective workshop actually come to sell food. They would come and take orders from all the neighboring organizations and companies, and they are so absolutely adorable.
Very abled,
and then you realize, but these are just people. Given the proper interventions and opportunities, they can thrive.
Very abled, it seems. Can you prevent this type of condition? Is it preventable for a child to get autism or be on the autistic spectrum?
I think one needs to look at risk factors. So one needs to look at leading a healthy lifestyle.
Okay.
And of course, if we're looking at pregnancy, ensuring that there's no abuse of drugs or unnecessary medication, self-medicating, avoiding, of course, eating a balanced diet, proper nutritional foods. Exercise would certainly be something, getting vaccinated. So, those would contribute to minimizing risk factors, because there isn't a single causal factor, you know. It could be environmental and it could be genetic. When we talk about the prenatal virus of rubella, the German measles, where it could increase the incidence of autism. And of course, genetic components, we know that it's more frequent in boys than in girls, because boys have the XY, and girls it's XX, so it's the chromosomal, the genetic composition.
Okay. What you've mentioned you've mentioned causes. What can we say that could explicitly, you know, we can look at some of the causes? Is it within the genes? Is it inherited? You've mentioned pregnancy. Yeah.
It could be in the genes and of course inherited, but that doesn't necessarily mean that the parents have that genetic component of autism.
So it's still a discovery at the moment?
I think there's still a lot of research being conducted. I know Professor de Vries from the University of Cape Town is quite a fundi on the subject and has done extensive work, and is still busy doing a lot of research in this area.
So we'll unpack more on this topic with our other expert that will be joining us just after the break, and do continue the conversation. It's Autism Awareness Month. Back in a moment. Assalamu alaikum and welcome back. A very good evening. This is Health Matters, and today is World Autism Day. We also understand that is Autism Awareness Month as we continue this appropriate discussion, and hopefully it will go on for the rest of the year, but highlighting it for this month, alhamdulillah. With me, Dr. Shaida Umar, and now joined us Christian Samuel, who is from the Center of Autism Research Education Care. We're just going to stick to care. But before we do get into that, we must welcome you to the show. Thank you very much for being here. Very good evening.
Thank you so much for having me. Good evening to both of you.
Absolute pleasure. So, Christian, you are a speech language pathologist and therapy director at CARE. Tell us about the work and what was the inspiration in starting an institution like this?
Well, CARE was originally started by my partner, Rosanna Reback, and the vision for CARE back in 2011 was really to be a place where children could come with all professionals under one roof. They could get the intervention, the information, all of the things that they needed. You know, for a family who's been newly received diagnosis, it's very difficult to know where to go. And 8 years ago, it was even more challenging. Thankfully, more service providers have popped up. You know, there are more services available now, but nearly a decade ago when we started, it was quite challenging to find the right information if your child had newly been diagnosed with autism.
I love how you say the family has been diagnosed with autism, and this is the approach which we like to take for today. And when that individual, that child, does come into play, it's actually the role of the entire family. So just on that, what does CARE offer
So
the family?
CARE offers a variety of services. We're offering a therapeutic intervention approach. So we have speech therapists, we have occupational therapists, we have special needs educators, and all of our interventions is based on therapeutic intervention principles. So we're looking very much at the child from a developmental perspective. We're looking at all of those different areas of development that are affected by autism and how we can offer intervention for those different areas. But just to go back to your earlier point, it is very much seeing the family as a unit. You know, our first contact is with the mom or the dad, and kind of seeing what the struggles they are going through and how they're coming to terms with the diagnosis, how the other kids of the family are dealing with the diagnosis. Those are all important factors to take into account.
Wow, brilliant. How long has it been around? You said 2011?
Yes, we started in 2011.
And the history of it from 2011 till today, what's happening and where's it going?
Yeah, well, we've gone from strength to strength, which has been really fantastic. You know, we started off as a very, very small school and we only admitted learners up until 6. And then we had to slowly expand that age range just because the demand was so high. At the moment, we're currently embarking upon another stage of expansion. We're partnering with a business incubator in South Africa called Race Corp, and and that is so that care can expand and so that we can build more schools. Also, our focus now needs to be a little bit broader, because, we really need to acknowledge that children with autism become adults with autism.
Yes.
And it's really about also, absolutely, it's thinking about it from a lifelong perspective, thinking about autism across the lifespan,
Absolutely.
not just necessarily, while the early intervention phase is very, very important, we also need to look beyond that. So in terms of our expansion then, care is kind of looking at what comes next.
Brilliant. So let's talk about autism. Do people who have autism find it hard to do things compared to those without autism? We know there is a distinct difference.
Absolutely.
But
Absolutely. I think our ethos is always different, not less. So that means, we're looking at them in terms of their neurodiversity. Okay. And if we break that term up, it means that essentially their brains are quite different. So they process information differently, they view the world differently. And so when you're teaching a child with autism, it's saying, how can I present this information to the child in a way that would make sense to the child? So yes, there absolutely are going to be certain barriers, but then there might be certain facilitators as well. So children with autism, for instance, they process visual information quite well, but they don't necessarily process the auditory information as well. So it's really about looking at what their strengths are and trying to use those strengths and compensate for their weaknesses.
I know the discussion is on autism, but this now brings up for me children in general, that each child is different, as Dr. Shaida said. They are unique, they have their own temperament. So you have to, and even with the many children that I have, and I'm sure Dr. Shaida can say that the same, each child needs to be approached, disciplined, talked to differently. You cannot use it. So with autism being highlighted in this way, and the therapies that's surrounding them, just makes it, so much more, brilliant to the public as well, to understand that this is, a condition that needs it.
Just interject, Yahawa. I think it's important to emphasize and labor on that point, because the interventions for an autistic child as well, as I said, every child is unique, and an autistic child is also unique. So the same intervention, you cannot have a one size fits all. The interventions will be tailor-made specifically to meet the individual needs of their child. And I think it was so clearly articulated by my learned colleague when he spoke about all the different modalities of interventions that they provide, because it's speech and auditory, but it's also occupational therapists, it's also remedial therapists, it's also instructional medium that is provided, because children with autism need a more structured environment. Children in general require structure, but the instructional medium, the consistency, ensuring that there's that kind of connection and contact. And what you articulated beautifully is about the visual impact, the pictures, the demonstration, by actually demonstrating to children with autism and using pictures. And why I'm emphasizing that is that we got a lot of training from the School of Autism for our children when we had to prepare them for court preparation. And children with autism, we thought, how do we actually take them into a courtroom and explain to them the processes, but with visuals?
Absolutely.
We certainly found that it made an impact. They were able to process that information.
And we find that other modalities, exactly like you're saying, visuals and so forth, are so powerful, because we find that that way we can get through to children with autism. And, we don't necessarily always need to rely on the verbal channels. We don't necessarily need to rely on spoken language. We can use other methods, other modalities that definitely do appeal to them and their way of thinking. I think another important point that you raised is that every child with autism is different, So the child with a more severe form of autism and a child with higher functioning autism, their needs are going to be very different. Their developmental trajectory is going to be quite different. Some of them may be able to mainstream, whereas for other children with autism, that might not necessarily be an option. So in terms of that individualized education plan, and in terms of tailoring an intervention plan to the child, that becomes of the utmost importance.
But I want to also emphasize that we mustn't create this misperception of developmental disabilities, because there have been many geniuses that have come from the population of autism, and musicians, other talented professionals that, so autism doesn't mean necessarily that they are limited. There are definitely strengths, and I think it was so beautifully said where you say you just enhance that and you work more on those strengths.
Yeah. Okay, so it's definitely then completely misunderstood, autism itself. I've often heard people, children being diagnosed, being on the autism spectrum. So just explain that.
Okay. So what the spectrum really speaks about, I think, is just going back to what we were saying, is that every child with autism is different, that there are different severity levels. When we're looking at autism, we're looking at 4 main components. We're looking at social interaction, we're looking at language and communication, we're looking at behaviors and patterns of behavior, such as obsessive behaviors, and then we're looking at the sensory system as well. Now, what's really important to remember is that in each of those 4 areas, one of them may be affected to a larger degree, another one to a lesser degree. It just depends. And if you look at that whole profile, that's how you're going to kind of get a composite, and you're going to see the child holistically. And that's really touches on the spectrum. And what we're looking at in terms of the severity, in terms of the differences in those 4 areas, which one is more involved, which one is less involved, where difficulty is more pronounced. We might see that some kids tend to really obsess about things. They're lining up their toys when they get older. They have fixations and obsessions and compulsions, but maybe they are able to communicate verbally.
Yeah.
Whereas other children with autism aren't able to communicate verbally at all. Yeah. They need an alternative system of communication. So that's really the spectrum that we're talking about. It's the diversity really that we're seeing.
So it seems here, Dr. Shaidama, the entire family needs to be educators. Take us through some of the steps when it comes to, getting the family involved and having the mother and the father communicate with the child, or even the siblings, in the most appropriate way that the child would be able to communicate back.
I think the first step really is just acceptance of the child's diagnosis. I think what we find is that, that denial process might go on for a long time. Sometimes health professionals are to blame for that because they might not necessarily want to use the term autism. They might not want to give that diagnosis. They may say your child's going to grow out of this, just give it 6 months or a year. They've just got delayed speech. So sometimes health professionals are actually to blame for that denialism that we see coming through. But more often what we see is that it's just very difficult to accept. It's a diagnosis that's not well understood, and it's very difficult to accept. Sometimes we speak about it almost as a silent disability, because if you have a child in a wheelchair, it's obvious they have a physical disability, they can't walk, they need a wheelchair.
You see it,
parents get them a wheelchair. Whereas with children on the spectrum, it's a little bit more difficult. Is it just a delay? Will they show normal development later on? All of these questions come up.
Let's talk about that, Dr. Shaida.
But I also want to add something. When you say the family is so affected because it's that whole grief cycle of the shock, the denial, the anger, and eventually
and the blaming as well.
Indeed. And I think what one needs to understand is that people see this as a social stigma, and families see this. They shy away from the community, from the public around embracing their child, almost as if they blame themselves. It's because of me. I've produced a child like this. So it's a humiliating experience and shame. And I think that is something that when Christian spoke about the counseling, working through that, working with families, because no child exists in isolation. Or is actually part of a whole. And it's also working with the other children who are not autistic and would feel guilty or would feel overlooked, or neglected, ignored, because now all attention is focused on this child. And children with autism, we know some of them manifest anxiety, depression, and also attention-seeking behavior.
Okay.
So these are the things that families would have to be counseled on, a lot of awareness raising, education, psychosocial skills on how to address and manage, because there are lots of nuances and subtleties that they could work with regarding their child, but also encouraging them that yes, it's a lifelong disease, but there is potential for growth, and earlier intervention, the better the long-term outcome.
Seems like there's a lot of work for the family to be done, to do rather, when this diagnosis is made. And from my understanding, what our elderly folk always used to say, to have a special needs child, you are you have a heavens child. They say Jannah. In our terms, you have a Jannah child. So that is your step to heaven. And we'll stick to that, understanding that this is a special child of the divine and Almighty brought it into your home, into our community. How can we better for them? We'll talk more on autism just after this. Assalamu alaikum and welcome back. Today we celebrate and we make you aware of the entire month, but today we celebrate the 2nd of April. Put it in your calendar, World Autism Day. A very special child that has been placed in your home, in our community, that we need to take care of. And the more and more we do for them, the reward actually comes back to us. Alhamdulillah. So this special Jannah, heaven child, as we would say, Dr. Shaida and Christian, thank you so much for joining us once again. And we just, in the break, we had a caller who just called in from Cape Town. Thank you so much, Auntie, for calling. So please do continue. The number is on screen and you can call us live with your autistic questions. So she's mentioned her daughter passed away 6 months ago and she's caring for her grandchild who's 12 years old. I think it's a boy. She mentioned that he has cerebral palsy and he's got a drooling problem, and she also mentioned something about the walking. So let's quickly delve into that.
Yeah, so in terms of cerebral palsy, which is another type of developmental disability, that's primarily a disorder of motor function. Okay. Drooling is quite common, largely due to the low oral motor tone, and because of problems with those muscles in the mouth and the cheeks. There are a range of treatment strategies. I can't really go into them in too much detail, okay. But what I really do think would be important is to see a speech therapist and a pediatrician. I think that would be really important.
I just want to echo that. There must be a neurodevelopmental pediatrician who's worked with a cerebral palsy child. Okay. She needs to go back and actually discuss this, because to look at what interventions have been provided, what has worked and it's not working. So obviously the pediatrician would be the
and of course
guiding
this is a
professional.
medical condition with happening in the mouth. So definitely go and see your pediatrician and who
a
cares
neurodevelopmental pediatrician.
Okay, and she's based in Cape Town, so she'd have to go and search that quickly. I know Autism SA.
Red Cross Hospital would be the right place.
The first protocol, Dr. Shaida, do you have to see your GP before going to Red Cross?
If she could get a referral.
From the GP. Okay, so highlighting this holistic approach to diagnosing the family, and I want to look at that quickly and unpack, understanding the work that the family now has to get into. So when you were approached by the autistic family and the different disciplines that this this child, this differently able child now has to undergo, what is the approach, the first approach that is undertaken?
Well, I think the first approach is really just knowledge sharing and making them aware that, autism is a lifelong condition, that this is going to be a long process and that it is going to take a significant commitment from the family. Okay. So we can do quite a bit of the work and we can provide quite a lot of the intervention, but that intervention doesn't stop when the child leaves school. So that continues. It continues at home, it continues on the weekends, it continues during the holidays. I think what's also important is that we see really great results from, we spoke about denial earlier, and the families who have managed to accept the diagnosis, who understand the diagnosis, understand that there is no cure for it, that it is lifelong, they are the ones who are better able to take on our intervention strategies. Okay. They're better able to participate because they're just more open to those intervention strategies, and they understand that it's going to look very, very different. And I think that's really what the important thing is that, as a parent, it's so important to grieve for, you have all of these hopes for your child, and you might have other neurotypical children and you might see them developing and them going through their grades at school, and there might be that temptation to actually compare your child with autism to those kids, and you really need to be very clear that it's going to be two very different paths. And I think if you understand that from the outset, I think it makes the rest of the process a little bit easier. I'm not saying it's easy, I'm just saying it might be easier because there is that acceptance, there is that understanding. And also, unfortunately, in the world of autism, there is a lot of false hope and people offering cures and lots of snake oil salesmen, fly-by nights coming up with new cures, every week. And unfortunately, many of these aren't based on medical science at all. But parents really are desperate, and so oftentimes they'll jump onto that bandwagon, often spend lots of money in the process, only to be disappointed again.
Absolutely.
And the research shows the only thing that really works is that ongoing intensive intervention.
Let's talk about acceptance, Dr. Shaida, and
I think
socially what's happening.
A great platform and an opportunity for acceptance would also be to actually engage with other parents or caregivers of children who are autistic, because one learns by sharing, exchanging, and also expressing the fears, the anxieties, the concerns. So I think that would certainly enable families to come to terms with their situation and see that actually they're not the only ones plagued by this. There are other families plagued by this kind of disability, and that there is hope. So acceptance is a very difficult process and I think outcome to come to. And we spoke about the grief cycle. So it's a long, and one could accept and actually go back. Those steps come and go, because there's still denial. And I think you should said, where there's always this hope that there'll be a miraculous cure, and you're always looking out or seeking out for these kind of things. But unfortunately it's there to stay. But there are treatment modalities that can improve. But the more support that the parents get, the better it is for the child. So when I speak about support, it's not just about information. It's more than information. It's also working through their own fears, rejections, anxieties, and for them to seek therapeutic support.
Outside influences, what does that do? Walking with your child in a public place, going to functions, going to family functions, not going even.
And I'm going to ask a question. What is attractive of a child with autism? What is attractive of a child and a child with autism? Because what you're saying is that, do you actually want to be seen in a public place? Do you want to have this child next to you? Why not?
What is your intention?
Why not? Like every other child that you want next to you, what is it that won't allow you to keep this child next to you?
But I think, just, at care, when we speak to our parents about those issues, that is a major barrier for them. So some of them would say to us, I haven't been to a birthday party in years. I haven't taken my child to a birthday party. Or if I have to do the shopping, I could never take him with me. Just simple everyday things, going to a restaurant and so forth. And it really is challenging. It's challenging for the child on a sensory level. It's challenging on a social level. So that's also where we need to give them strategies. We need to give them specific interventions that are able to benefit them, and maybe also try and let them know that you can do it little by little. Don't put too much pressure on yourself. Kind of take baby steps initially and then build up, because we do find that it can be incredibly overwhelming. I think it goes back to you were saying earlier, the shame that the parent feels, and that shame and that guilt can be incredible, and then to go out and then feel like there's the potential for embarrassment in public.
Somebody's watching me.
Exactly. Or the misconception often is that, you've got a badly behaved child or a spoiled child, and that's why they're having a tantrum, in Woolworths. So I think those misconceptions do make it very difficult in terms of going out into society with a child with autism.
We are still taking your calls. Please do call in on the number on screen with your autistic questions. We have one that has just come in. My son is 4 years old. He has been on a Risperdal for a year and a half, and he was struggling with bad behavior and development. Currently has bad sensory. He finds it difficult to eat food. It has to be liquidized. He is going for speech and OT, but my main concern is getting him to eat. What can I do? This food,
That's a big one, because so many children with autism have sensory issues, and food is a huge one, for two reasons. Because they tend to prefer sameness, and they like things to be the same. So if they've decided they like a specific food, maybe because of the texture of the food or the taste of the food or the temperature of the food, they tend to stick to those same foods. He obviously likes things that are smooth textures and consistencies, hence they need to be liquidized. I think work with your speech therapist very closely, because that's the person who's the expert in this area, and start trying to introduce different foods very slowly. I think the one thing that I would caution after years of working with kids who have feeding difficulties is don't make it aversive for them, because once it becomes aversive for them, once they feel like they're being forced to do something, then you've lost the battle already. So that becomes important.
What you're saying is so important. It's that force feeding, because whose needs is this? Is it's about the parent feeling good or better about themselves, or is it actually the need of the child? And that's what we need to actually look out for. What is it that this child is needing and wanting, and how can we make it easier for the child?
I'm sure psychologically this doesn't just affect thinking that what's going on with this child, but it's actually affecting the mother, the father, the parents. It's bringing them down. My child's it's like a fussy eater. My child's not eating. What do I do? What can I do? And I know the child has to taste like 20 times with the little one. Imagine this, not knowing that your child's eating. So what's happening with the mother? What support should parents, what do we need to understand about that mother that's struggling with this autistic child?
What we need to realize is that food is a primary nurturer. So in the mind of the mother, that mindset is that I've got to feed my child. If I'll be seen to be a good mother if my child eats well, if my child thrives. So it's all about the mother's own issues and needs, not so much about the child. So it's working there and understanding why the mother's feeling this and where is it coming from and what could she do differently.
What is the solution? Just quickly to delve on this, because for me, I look at it as a mother. You struggle with a child with a behavior issue and the children constantly fighting, or whatever the case. I'm not going to take them out today. But what I've learned is when you start letting go, nobody's dying. There's no blood in the room. There's no medical serious condition. My therapists have told me this and that about my child. What do I need to let go of? What do I need to understand to let go as a mother?
I think there's a little bit of both, really. I think it's something that we would work on. So it's definitely an area that we would work on, but I think it's something that you could let the professionals handle. They've got lots of experience in that area, and I think as a parent the main thing, and this is the difficult thing, is trying not to be anxious about it. The child is eating, from the person who's asked the question. So they're not starving, they are eating. They're eating a very limited diet at the moment, and that is problematic, and only limited textures. So that is definitely something to work on. But I think also sometimes you just almost need to trust the process a little bit. And to go back to your point, absolutely, it's, separating, what is my anxiety and what is it about the child at the moment. We specifically do target feeding issues, and it is a very big part of the autism practice and autism intervention. But at the same time, we find that when they're hungry, they do eat.
Yes.
So they don't starve to death. So, absolutely.
So, moms, please don't worry and get too worked up about it. We have our experts in studio and we're taking your questions. Our producers are on the other side taking your questions. So, please, this discussion continues on autism just after this. Welcome back. 2nd of April, World Autism Day, and we talk more about the awareness and how this continuous talks has to happen on radio, on TV, in the newspapers, in conversations, having a cup of coffee, talking to your sister or calling your mom up, and this needs to come up. Autism, autistic, on the autism spectrum, and that's how I think the conversation can start, knowing someone, is there someone, how can we help organizations like this? So the way forward, how can we raise awareness? And I want to talk about that, just after this question, but medically, what are the sort of medical interventions? Because our last caller mentioned Risperdal, which is, of course, a drug, medication. So let's talk about drugs what...
Absolutely. So there are a range of pharmacological interventions, medications, drugs. I think the important thing just to mention on that topic, topic is that there is no specific medication that specifically is for autism itself.
Okay.
So there is no medication that necessarily is prescribed because a child is autistic and it's going to cure their autism or it's going to work directly on their autism. What we find is that there are medications that help manage the symptoms around autism.
Okay.
So if the child has an attention deficit, if the child has behavioral challenges, if the child is having sleep difficulties, which is very, very common in autism, we see seizures, absolutely. So we're seeing depression later on, anxiety problems. All of these things are the symptoms that we might see around autism. They're not necessarily going to fix the autism itself. So I think that's very, very important just to understand, and for parents to understand, is that when the doctor's prescribing something, it's going to be to treat those other symptoms. It's not necessarily going to get at the autism itself. I think the second important thing to mention with medication is that it's often very much trial and error, because each child responds differently to medication. It's very much also, how does that medication integrate into the child's life? What are the side effects of the medication? And we need to weigh all of these things up. Medication definitely has a role in terms of the overall intervention when it comes to autism, absolutely. But at the end of the day, we just need to kind of see where it fits in. There also needs to be that good communication between the doctor who's prescribing the medication and the family, as well as the other allied health professionals, such as the speech therapist and occupational therapist, because they're all seeing slightly different sides of the child. And so those that multifaceted approach is really important.
Dr. Shaida?
The rule of thumb, and I think just to pick up on that, is to start low and go slow. Because I think you've highlighted the issue around side effects, and each child will require different dosage or different medications. I think that's what doctors need to work out. So the communication between the primary caregiver and the doctor is critical and essential for the well-being of the child.
Who's usually the primary caregiver? The mother. We see her there all the time. And, dad, they take their turns. And I think it's important that from time to time, mom has to go and do her hair. She has to take a bath. And the family needs to pitch in. So understanding the responsibilities and the roles of everybody, is that something that is explained within therapy of understanding this condition?
I think it's a difficult one, because I think sometimes you find that the person who has been assigned that role of primary caregiver, and you say it's the mom, but sometimes we find that it's actually the dad. We have seen that.
Great.
They just tend to take on all of that responsibility and overburden themselves, and they don't really pay much attention to self-care, like you're saying, getting your hair done, getting your nails done. They don't actually pay too much attention, because they almost feel like the world's going to fall apart if they do those things.
They become rescuers.
Very much so. So I think it is just important that that burden is shared, and we've seen great examples of it at care. We've seen, where the grandparents are chipping in, where aunts and uncles and so forth are coming, and they're creating this unit, very much like the idiom, it takes a village to raise a child. And with an autistic child, it really does take a village. So you're going to need all of those support systems. I think something that we found that is quite interesting is that some of our families still find it hard to tell their extended family that their child has autism because of the stigma attached to it. And I think that's something that we need to open up a conversation around, is that how do you actually tell, your extended family? How do you explain to them what autism is? They might not even know.
Okay, Dr. Shaida, you could come in there.
Yeah, I think it's also important, because we have to look at disintegration of families, because of the high levels of stress and caregiving, it can become very burdensome, overwhelming, and as a result, impact on relationships and ties between couples as well, where there could be a total disintegration and collapse of the family. So bringing in the family for support is critical. I think that the spirit of Ubuntu, bringing in extended family, educating them, because the more information people have, the more powerful and empowered they feel in understanding and having insights on what they could contribute towards making it easier for the family. So looking at whether it's in-laws, grandparents, and siblings, etc. The more information they have, they would be able to be in a position to offer that kind of support.
What is the closest support system that does come in for families through your experience when they are struggling and they're battling with just accepting and putting the word out there, but they also need help?
Absolutely. I think in our day-to-day practice, we've got this open door policy, and it's really just saying, as issues arise, and usually it's the issues around autism, maybe behavior, maybe frustration with the lack of communication, maybe sensory issues, that you come come in, you chat to us,
Okay.
so that we've got that ongoing communication, we've got that ongoing counseling. I think sometimes for parents it just becomes all too overwhelming.
Okay.
So I think it's really just about having somebody there to talk to, somebody knowledgeable, or sometimes even somebody who's just able to listen without judgment, and just kind of be that ear for you. So for us, that's what works really, really well. It's just
Okay.
that ongoing kind of support, the day-to-day support, really, because that's really what autism is. It's it's every moment, it's every minute, it's every
Yes.
day, every hour, and it throws things at you,
Yeah.
completely unexpected sometimes. Sometimes things are going great, and then
All of a sudden
your child
there's
has
a
a
change.
meltdown, and so yeah, absolutely.
Okay, so just back to medication quickly. This mother wants to know her son who is on Risperdal. What are some of the side effects? And I know you're not a medical doctor, but as if you know any, he's 4 years old, been on it for a year and a half. Are there any side effects? What would they be?
There are side
possibly?
effects. It is a very strong medication. It's an
Okay.
antipsychotic medication, and usually it is prescribed to deal with the behavioral challenges that we see around autism. We always suggest, I love what you said, if you could repeat the phrase, the start slow.
Start slow and go slow, yeah.
Exactly.
Start low and go slow.
I think that's great, because we find that
Like
with
go
younger
slow.
children, you need to be very cautious with some of these medications just because they are so strong. They can have a range of side effects. We always suggest that, first kind of exhaust your other possibilities. So do behavior modification strategies work? Do communication intervention strategies work? Do all of those work or not? And then maybe kind of consider, the kind of pharmacological interventions as a last option, especially for younger children.
Okay, guys, we need to wrap up. A minute left. Dr. Shaida, your last words on this topic, and I know it's definitely not your last, but your closing comments.
Just want to say that every child is unique, and we mustn't forget that a child with autism is no different than any other child.
Absolutely.
And we need to give that child the best opportunities to develop to their best potential, because there is hope for every child, even if that child is autistic.
Great stuff. Christian, just support and also the way forward, where people can find more information as well.
Okay, fantastic. So you can find us at www.thecarecenter.co.za. I think I would just like to say it's so great that we're having this conversation. I think, in terms of autism awareness, not just Autism Awareness Day and month and so forth, but broader than that, I think it's just great to have the conversation so that people can get more insight into what autism is.
The website again?
www.thecarecenter.co.za.
Thecarecenter.co.za. Thank you so much. Shukran so much, Dr. Shaida. We hope to see you soon again when we're back on air on Health Matters, as well as Christian. All the best in the great work that you do. Keep going. May the Almighty give you guys the necessary strength to continue that. It was a pleasure having you on air. And as he said, and reiterate, get that conversation going. Whenever you're talking to somebody tomorrow morning, bring up the topic of autism and the mothers and the supports and the dads and the families. Let's find out who they are and support them. But for now, we're going to have to wrap up. Shukran so much for joining us. Thank you. Please do stay tuned. Remember, you can catch the show on YouTube as well if you've missed any of it on Health Matters. But from myself, Hawa Solomon, for now, assalamu alaikum and goodbye.